curious, slightly hushed. Elite athletics puts the human body on display at its absolute physical peak. But sometimes, in the middle of a routine play, a seemingly perfect biological machine can collapse entirely without a single hit from an opponent. To prevent those sudden, catastrophic failures, sports medicine relies on a massive filter before an athlete is ever allowed near a field. It's called the Pre-Participation Evaluation, or PPE, and its sole function is to calculate internal risk. Think of the PPE as a strict traffic light system. At the highest level of risk, medical staff issue a red light, which means no clearance. Participation is strictly prohibited. This table outlines the specific cardiovascular risks that trigger an automatic red light. Conditions like hypertrophic cardiomyopathy, an abnormal thickening of the heart muscle, or Marfan syndrome carry an immense risk of sudden death during intense exertion. In these specific cases, the PPE does its job. It prevents the extreme physical stress of the sport from acting as a lethal trigger for an anomaly the athlete never knew they had. Not every medical condition means an immediate ban. The protocol also includes a yellow light, or limited clearance. This applies to athletes living with chronic conditions who can still safely compete, provided strict operational guardrails are in place. Looking at the special population section, you can see these specific guardrails. A player with sickle cell disease is allowed limited participation, but coaches must relentlessly prevent overheating and dehydration. For a diabetic athlete, medical staff must monitor hydration, diet, and insulin continuously. If an athlete clears the PPE, either by showing no underlying issues or safely managing a chronic one, they receive the green light, full clearance. They are authorized to compete without restrictions. Once an athlete secures that green light, the focus of the medical team completely changes. They are no longer looking out for sudden systemic death. They have to prepare for the acute mechanical destruction of the human body. To understand how bodies break, you have to look at how they generate force. Look at the explosive output of a sprinter running a 100-meter dash. They rely on fast twitch muscle fibers, fueled rapidly by the ATP-PCR energy system, which supplies enormous energy for about 30 seconds. When you push the body's physiological limits to produce that kind of kinetic output, the structural materials holding the machine together are placed under immense mechanical stress. Often, they tear. This classifies soft tissue failures. A sprain denotes a structural failure of a ligament connecting bone to bone. External forces cause these fibers to tear. Contrast this with a strain, where overstretching occurs in a muscle or tendon responsible for moving the bone. Correctly identifying the exact biological anchor that snapped tells the physician exactly how to plot the timeline for the athlete's recovery. Sometimes the force of an impact is too severe for the soft tissue to absorb, and the rigid framework of the skeletal system itself gives way. This table defines joint displacement. A dislocation is a complete separation of joint surfaces. Bones are no longer touching. A subluxation is a partial, transient separation where some contact remains. Notice the requirement. All dislocations must be X-rayed to find hidden splintered bone fragments. Accurately diagnosing the exact degree of that displacement is vital. Missing a bone fragment or failing to stabilize the joint leaves the athlete with chronic instability and a guaranteed path to premature osteoarthritis. In sports with intense physical demands and aesthetic pressures, like gymnastics, the biggest threats are rarely sudden collisions. The danger lies in chronic, invisible conditions that slowly break an athlete down over time. This infographic outlines the female athlete triad. The initial trigger is low energy availability, often from restrictive eating. This initiates a downward endocrine spiral, causing menstrual disturbances, or amenorrhea, which starves bones of hormones, causing severe drops in bone mineral density, or osteoporosis. Another silent threat is the concussion. When an athlete suffers brain trauma, they immediately trigger a strict neurological safety protocol. The primary role of that protocol is absolute. An athlete is prohibited from returning to play on the same day under any circumstances. A shattered bone is visually obvious, but systemic exhaustion and hidden brain trauma require the most unyielding medical interventions to prevent permanent consequences. The moment any of these injuries occur, the athlete is stripped of their clearance. They are relegated back to the red light, and the grueling, multi-phase rehabilitation protocol begins. This rehabilitation staircase maps out the physical journey back to the field. Phase 1 strictly addresses acute management to reduce pain using the Price method: protect, rest, ice, compress, and elevate. Moving into phases 2 and 3, the objective shifts to restoring range of motion and rebuilding the core stability required to support the injured limb. Simple tissue healing is inadequate for a professional. The musculoskeletal system must be actively and repeatedly retrained to bear extreme weight without failing a second time. Eventually, the general physical therapy concludes, bringing the athlete to the final threshold, proving they can handle elite kinetic forces again. Phase 4 demands sport-specific simulation. The athlete's repaired body is stress-tested against the exact biomechanical movements they will execute in their specific game, at full speed. The final medical checklist in this protocol outlines strict criteria for the ultimate return to play, or RTP, decision. An athlete must display a full range of motion, and their injured limb must achieve greater than 90% of the strength of their uninjured side. Sports medicine operates as a continuous protective loop. It calculates upfront risk, repairs the inevitable biomechanical collapse, and ultimately safely guides the athlete back into the glowing green light.